Hi everybody, my name is Simon Chen. I'm a medical doctor in Hualien, Taiwan. I have been practicing Chinese medicine for 40 years since I was graduated from a medical school in Taiwan. Today, it is my pleasure to introduce some concepts about pulse diagnosis in Chinese medicine. Introduction to TCM Pulse Diagnosis, Simon Chen, 2021, July 8, Hualien, Taiwan. My briefing on TCM Pulse Diagnosis. Traditional Chinese medicine pulse diagnosis is one of the four principles of examination which applies to TCM diagnosis. I think you have already had some lectures about the four principles of examination, and later on in this lecture I will give you some facts, just one or two sentences about these four principles of examination to let you to review this topic. It's quite important. Content of this lecture. Today, I'm going to tell you about the bare facts on TCM Pulse Diagnosis. Compare pulse studies on Orthodox Western medicine and traditional Chinese medicine. Actually, in Western medicine, they have had pulse studies, pulse readings clinically, not only Chinese medicine. Later on, I'm going to tell you more about this. Grasp the idea of how TCM doctor performing pulse diagnosis technically and clinically. It takes many years to practice TCM pulse diagnosis for a medical student, so it's not so easy. It's skillful and coordinating to patient clinically. The purpose of pulse diagnosis is to make a concise diagnosis in terms of TCM diagnosis zhen. Later on, I will give you some idea about zhen. And pulse diagnosis will give some important information to make a diagnosis about zhen. Finally, and last, a clinical example will be elicited as a complementary topic. I'm going to give you a clinical example in order to give you some idea about how TCM doctor are going to think about pulse diagnosis and how they make a decision. Pulse readings on Orthodox Western medicine. Modern pulse experimental studies has been well established since 1940s. Leading by Wormersley, he is a physicist, and McDonald is a medical doctor, based on hemodynamic concerns. Now, this is a very famous textbook. McDonald blood flow in arteries, theoretical, experimental, and clinical principles, the 6th edition. And so they have long history and experiments mathematically to calculate the hemodynamics of blood flow, pressure, impedance relating to cardiovascular system. They are going to keep going to do experiments nowadays. Some famous clinical pulse patterns in Western medicine. Actually, if you learn about the cardiovascular system, in some textbooks, they have some pulse patterns are important clinically, because if you feel the pulse and then you can tell what disease and relating to this pulse readings. The first one is the collagen fiber. Sometimes we refer to water hammer pulse. It's a very big upstroke and very quick downstroke. We call it the water hammer, up and down pulse. Sometimes in the pericarditis, pericardial tamponade, they have this kind of pulse. Bispherian pulse in aortic regurgitation. This is a two-peak pulse. Two-peak pulse in the upstroke. The pulses alternates. Alternation of weak and strong pulse beats. Sometimes we call it the bigeminy pulses. Strong, weak, strong, weak, strong, weak. Pulses paradoxes relating to breathing cycle. When we breathing, the pulse, if the chest expiration, the thoracic pressure lowered, and the pulse jump up, and in inspiration, the volume decreased, pulse increased, and we give the picture of slow, low peak pulse. So we have the pulse up like a wave, How about traditional Chinese medicine pulse diagnosis? Bare facts on TCM Pulse Diagnosis. We have this history of pulse diagnosis well documented about 500 BC. That is 2,500 years ago. One of the four principles of TCM diagnosis. Okay, I think you have already learned something about this. Let us have some quick review. Inspection, audition, smelling, interrogation, and pulsology. So pulsology is one of the four principles of TCM Pulse diagnosis. And it's important for you to know the TCM Dr. Mega diagnosis is different from the modern medicine. We focus on Zhen. What is Zhen? The 8 principles of Zhen. Zhen is divided into yin yang, exterior interior, hot cold, redundancy, deficiency. So you may notice that exterior interior means the outside of our body or inside of our body. is from outside or from inside. It's internal diseases or it come from exteriorly, as such as wind, cold, etc. Our body should be hot or cold or mix up. Redundancy and deficiency is the body status. If too much, that is redundancy. We should break down or to eliminate the unwanted material from the body. Deficiency means qi deficiency or blood deficiency. That is not enough. Our body status is not enough. For example, if you don't eat for 5 days, and then your qi and blood must be in the status of deficiency. So these 4 pairs is opposite direction, in opposite position. Yin yang, exterior, interior, hot, cold, redundancy, deficiency is opposite. So sometimes it's difficult to tell clinically, but post-diagnosis can help us to make a decision. The diagnostic purposes on TCM Pulse has very big differences from Orthodox Western medicine. So far, you will notice that our interpretation of diseases is different from Western medicine. Pulse diagnosis was well documented by a prestigious historian, SimonChen. It's about 145 BC. With 52 medical records, which were as concise as the form of medical record nowadays. So this historian made a very clear and concise ratings about the history of medicine in China. This famous medical doctor who invented pulse diagnosis was Ben Che. You may notice this picture. This picture is on a wall in China. It tells about this bird-like human is Ben Che, who performing pulse diagnosis. And in the medical records, there are pulse readings recorded in these 52 medical records. What is the role of pulse diagnosis in TCM? For me, it is like the rudder of a boat which can steer around all directions. If a boat with a rudder, it can go everywhere. You can control it easily. But if the rudder is malfunctioned, then you cannot control the boat. Although your boat is perfectly normal or functional normal. But if the rudder is broken, you can go nowhere. A concise view on performing pulse diagnosis. Okay, I'm going to give you some insight about how a TCM doctor read the pulse from a patient. This is the left hand, sorry, this is left hand. And then we have some landmarks, anatomical landmarks. Especially the radial apophysis is important. Firstly, we locate the apophysis. Okay, we locate the apophysis here, and then we put the middle finger on it. And then we call it, we divide the location into inch, bar, and cubit. In Chinese is 称关尺. Firstly, we locate the bar, because the bar is the landmark on the radial apophysis. It's very prominent. The apophysis is very prominent. We put the middle finger over it, and then we put the index finger in front of the middle finger. Lastly, we put the ring finger just after the middle finger. That is 寸, inch, 关, bar, and 尺. These three fingers all together. Okay, you cannot do it freely. You should follow the rule. What is the rule? Put the middle finger and the ring finger and the index finger. Okay, index finger. So you should put it exactly on this location. So it's very tight and concise location. You cannot put it anywhere you want. Okay, you cannot put it here, or put it loosely. You say put it as the rule, as this picture. Otherwise, your reading is different from mine because the location is different. So this is the rule. Okay, the golden thumb. Okay, the golden rule. So you cannot freely to do this. You can follow the rule. Fingers putting on the radial pulse. Put 3 fingers on the radial pulse as inch, bar, and cubit. 寸, 关, 尺. Both hands we have 6 target points. Why is 6? Because we have 2 forearms, 2 hands. The left 3 location and right 3. So it is 6. At each point, TCM doctor applies linear forces from top to the bottom. We put the finger lightly, very light, to feel the pulse, and then we apply pressure over it, each finger, and then we dip it, okay, and deep, and then light, from light to deep, from deep to light. Okay, you see? Like this. And then you tell the pulse how you feel. Sensation of the pulse patterns, raise, weak and strong, etc. Tell me the time. What are they thinking and concerning about? Strong pulse sometimes means exaggerated forces, which may cause diseases in our body. Usually, it will give the concerns about pulse diseases such as differential diagnosis of exterior 6 trigger factors: wind, coldness, heat, dampness, dryness, and fire. I think some other doctor has had already tell you about these 6 triggering factors. Sometimes they refer to 6 evil, but anyway, I translate it into 6 triggering factors exteriorly to come from outside. Okay, actually this is it's good thing, it's not bad, or not evil thing. Interior discomfort such as acute gastroenteritis. Okay, this is from outside, this is from inside. Okay, so this is redundancy diagnosis, exaggerated forces from outside or from inside. So it's redundancy. Okay, it's an example of redundancy. How about a weakened pulse? It may be concerned about chronic disease, yang deficiency, and yin deficiency. A weakened pulse, that means is deficiency. The previous one is the redundancy. Okay, this picture is the redundancy. This picture is the deficiency. So it's in opposite direction. And our prescription is all different. A clinical example. I give you an example in order to give you some insight about how a TCM physician think about clinically. For example, this is a 25-year-old lady with the chief complaint of dizziness, headache, and mild nostril stiffness, which has just happened for 1 day. And her menstruation will become soon. No party should like this event during menstruation. This event is dizziness, headache, etc. Her blood pressure is 120/80, heart rate is 80 per minute. How does a medical doctor make a differential diagnosis? Menstruation period cause, exterior causing, wind damage, heat, chronic disease with Qi deficiency. How to differentiate this term? So it's difficult. If you just refer to dizziness, headache, and nostril stiffness, these symptoms, sometimes it's difficult to tell. But if you have the help of post-diagnosis readings, you may tell more clearly, or to make a final diagnosis concisely. What post-diagnosis can tell in this case? Strong floating pulse used to be exterior wind, etc. Strong but deep pulse may be caused by menstruation. Deep, stringy pulse may be caused by Qi deficiency. So it's clearly, post-diagnosis can give us the direction of the diagnosis. Conclusion. Post-diagnosis tells the differences between the 8 principles of TCM Zhen. Okay? Usually, it is required a TCM young doctor over 10 years to practice pulse census and correlate clinical data from thousands of patients. It takes years to learn. You should learn about the theory, the skill, the clinical coordination. Integrate all this together, and then you may tell the pulse. So it's skillful. It's not easy to learn. It's difficult. Chinese medicine is sometimes it's more difficult than Western medicine in a certain point of view, because Western medicine, they have with the help of so many scientific instruments, such as X-ray, MRI, laboratory, but TCM doctor don't. This is just by inspections, smelling, pulse diagnosis, interrogation, and all this is so primitive to Western medicine. But our the advantage in Chinese medicine is it really can cure diseases. So don't forget, pulse diagnosis. Okay, the purpose of pulse diagnosis is making a precise remedy for the disease. I think clinical practice, the goal is to cure disease, right? I think everyone should agree with it. No matter you use Western medicine's point of view or Chinese medicine. Finally, you just cure the disease. That's okay. Don't forget, pulse diagnosis is only a small part of TCM, like the rudder of a boat. It gives you directions. It gives you further interpretation of disease, the treatment, the thinking of a TCM physician. But it really plays an important role, which is from TCM theory to practical diagnosis and treatments. And to help a medical physician to make a final clinical decision. Okay, make a final decision is important in the real world. You make a concise diagnosis and then you have the fantastic or good treatment to the patient. Okay, Chinese medicine is quite the effect, the experiences has already been accumulated for 2,000 years, for 3,000 years. So we have so many good experiences on treating diseases, and it's really helpful to relieve the symptoms or diseases of the patient. Sometimes Western medicine is not so good as Chinese medicine. Of course, we have our pitfalls too. In certain diseases, of course, Western medicine is much superior than Chinese medicine. But in certain diseases, many diseases, especially in an outpatient clinic, we can treat so many different diseases, and they give so good remedies to cure the patient. Hopefully this lecture gives you some knowledge about traditional Chinese medicine. I think some other medical physician may give you further lectures in TCM, and hopefully you have a great picture in Chinese medicine and in interest in it. Okay, that's my lecture today. Thank you.